Hello, myself Manjusini. We are started about the preeclampsia. The definition: preeclampsia is a pregnancy-related disorder characterized by high blood pressure and of damage of other organ system, typically occurring after the 20 week of gestation. Then we are start now. Symptoms. Common symptoms of preeclampsia include the high blood pressure, often the first sign detected during the routine prenatal visit. Second, proteinuria, presence of protein in urine indicating the kidney involvement. Then next, swelling, particularly in the hand and face. Severe headache, persistent headache that does not respond to usual pain relief. Then next, visual disturbance such as blurred vision, seeing spot and light sensitivity. Upper abdominal pain often under the ribs, which may be confused with other conditions. Then causes and risk factor. First of all, placenta issue. The condition is thought to begin in the placenta where blood vessels do not develop function properly. This can lead to reduced blood flow and oxygen to the placenta, causing complications. Then genetic factors, there may be a genetic predispositions to preeclampsia as it can run in family. Certain genetic markers may increase the risk of developing the conditions. Next, immune system response. An abnormal immune response to the placenta may also play a role in the development of preeclampsia. This can affect how the body adapt to pregnancy. The next risk factors, several factors can increase the likelihood of developing preeclampsia include: first, history of high blood pressures. Women with a history of hypertension or kidney disease are high risk. The next, multiple pregnancy, carrying twins and more increase the risks due to the greater demand of bodies. Then first pregnancy, third time mother can more like to develop the preeclampsia compared to those who have had previous pregnancy. The next, age over the 35-year-old age. The next, obesity, high body mass index is associated with the greater risk of preeclampsia. Next, chronic conditions such as diabetes, lupus, and certain autonomic disorder can elevate the risk. Then next, diagnosis: high blood pressures, blood test, urine analysis, fetal ultrasounds, non-state test, and biophysics profile. Next, management. First, blood pressures control, antihypertensive drugs. Goal to prevent the stroke and other severe complications. Next, medications: labetalol and beta blocker, nifedipine, calcium channel blockers, and hydralazine vasodilators, and common chronic and methyl dopa also used. Next, seizure prevention, anticonvulsant. Magnesium sulfate, the first line treatment to prevent the seizure eclampsia. Then administration given the intravenously, often with the loading dose followed by the maintenance. The next, monitoring require close observations for sign of toxicity, loss of reflex and respiratory issues. Next, fetal lungs maturities. Corticosteroid administration, if the performed delivery before 37 weeks, is anticipated to help the baby's lungs develop faster. Then next, monitoring lifestyle. First, hospitalization often required to severe case of continue monitoring. Next, bed rest may be recommended for mild case to improve the blood flow to the placenta. Next, test: frequent blood pressure check, urine test for protein, blood test for liver, kidney functions, ultrasounds, and fetal heart rate monitoring. Delivery, the cure. The only definitions cure for preeclampsia is a delivery of the placenta. Timing depend on severity. Delivery after 37 weeks of mild case or early, around 34 weeks. For severe preeclampsia, balancing material risks and fetal maturity. Then medication for high risk prevention. First, aspirin. Low dose aspirin started early in pregnancy can reduce risks for high risk women. And thank you.